Hi, everybody. I'm Congressman Krishnamoorthi of the 8th District of Illinois. Thank you so much for joining us again. And today we're having a little bit of a pop-up town hall to talk about protecting affordable health care in general, and of course, the ACA and Obamacare in particular, as well as topics related to Medicaid. Something called the Big Beautiful Bill, which President Trump signed into law. I call it the Large Lousy Law, is already wreaking havoc on healthcare because it's going to strip 535,000 Illinoisans of health coverage. It's going to put rural hospitals as well as some urban centers at risk of closure, hurting everybody, regardless of whether they're on Medicaid or not. And now we have the expiration of Obamacare tax credits, which are crucial for those who want to purchase health insurance on the healthcare exchanges. Open enrollment is about to begin on November 1st. So this is a very timely topic, and we are starting to get a lot of questions. And it happens to be an issue that is front and center with regard to negotiating the full reopening of government. And so today I wanted to bring a super expert on these issues, Kathy Walagora, who's the Deputy Director of External Affairs for Ever Thrive Illinois. She is also a leader with Protect Our Care Illinois. She has a very long and distinguished record, but I'll just say that she has been kind of at the forefront of advocacy for everybody to be able to have access to health care and health insurance. And she's just been an incredible resource to my office and to me personally in answering questions about all things healthcare related. So with that, normally we go into a big spiel. Tonight, we're going to go into questions very quickly because we have so many, and I want to give Kathy a chance to answer as many as possible. We're going to go a little bit shorter on this town hall meeting than normal. It's going to be more like 30 minutes as opposed to 45 because of scheduling issues on the other side of this town hall meeting. But with that, Kathy, thank you so much for joining us. I'm going to get right into this right now. So, okay, tell us a little bit about what's about to happen with open enrollment for the Obamacare exchanges, and why are these tax credits important, and what does it mean for, if you can give an example of a typical family and what they're going to be seeing if these tax credits expire.
Yeah, thank you, Congressman, and thank you for having me. So, yes, as you said, we are about 2 weeks away from the start of open enrollment, which is the time of year where folks who need to purchase individual or small group health plans on the health insurance exchange, the marketplace, an Obamacare plan, whatever you might call it, can go online and look at all of the plans available to them, enroll in the best medical and dental for themselves and their families, and access financial assistance to reduce both out-of-pocket costs like your deductible and your cost sharing, as well as your premiums. We are looking at a uncertain year. Usually at this point in the year, we know what our plans are. We know what they're going to cost. We know who the networks are. We know everything right now. But right now, we don't have that information because, as you mentioned, these healthcare tax credits that reduce premiums are set to expire at the end of this calendar year. And Congress has not acted to extend them, which means insurance companies are increasing their premiums, and folks are going to may lose some of that financial assistance. So there's a lot of uncertainty in the market right now at a time when we're really trying to encourage folks to go look for health insurance, because we know that's a really important thing for both physical, mental, and financial well-being.
Okay, so basically, I have a lot of questions here, but I should just say, if these tax credits are to expire, it's estimated that
Yes.
5 million people are going to lose their health insurance over the next decade. And in my opinion, many more will see their premiums skyrocket. And if these people end up going to the emergency room or getting uncompensated care, essentially all of our premiums will increase, regardless of whether you're on private pay, Medicare, Medicaid, or of course on the Affordable Care Act. I happen to be on the Affordable Care Act, so I know we are paying close attention to the open enrollment period as well. Okay, Kathy, what if I don't have insurance through the ACA? Will my premium be impacted directly if the tax credits expire for other people?
Yeah, so what we're seeing is volatility and uncertainty across the health insurance market, and that is absolutely impacting prices. For better or for worse, insurance companies are cautious. So with the impact of the Medicaid and private health insurance changes in the I forget the term you came up with, but the one big
First
beautiful
lousy
act.
law.
Yes. With the changes from that and then this uncertainty around the tax credits, insurance companies are hedging their bets. So, across the state, we're seeing an average rate increase of about 28% in premiums for individual plans. On exchange, everybody is going to see an average increase of $130 a month, according to Get Covered Illinois. So whether you're on exchange or off exchange, you're probably seeing an increase in your premiums this year. If you are on exchange and you have any sort of financial assistance, those increases could be much higher. Folks could see their premiums doubling in terms of their out of pocket if they lose that financial assistance. And I forgot to answer your earlier question, but what that looks like really varies based on where you live, what your income is, what your plan is. But an example is when it comes to the premium subsidies or the tax credits, is a 60-year-old couple making $82,000 a year in Illinois could see their premiums increase by almost $18,000 next year, to a point where it would be 20% of their annual income because they have that increase we're all seeing and the loss of support.
It basically puts insurance out of reach at that point. Um,
Yes.
I heard, okay, so here's a question. I heard that ACA tax credits are full of fraud. Is this true? How are Democrats working to make sure only people that need these tax credits are actually getting them?
Yeah, great question. So I think we hear this fraud talking point a lot, and it's meant to distract from the fact that folks who don't support the healthcare tax credits don't have a plan to help people pay for their health insurance. So I want to just name that off the bat because it's disingenuous. We don't see significant levels of fraud. The process of enrolling in tax credits requires significant identity verification, citizenship and residency verification. You're turning over a lot of information to the federal government and to your insurance company. And then that money, that tax credit actually goes from the government to your insurance company. It's not cash in anyone's pocket in a real sense. So
Hmm,
there's pretty low incentive for fraud in the first place.
that's a good point. Um, okay, let me ask you this. Is healthcare going to be impacted by the shutdown? And then what about SNAP and WIC? Okay, I'll answer this. As of right now, the one thing that we are all very sensitive to is these tax credits expiring. And yes, at that point, if there's not action with regard to those tax credits, we're just going to see the healthcare premiums spike. And that's why it's so important right now for the president to come to the table and make this decision to keep people's health coverage affordable. That's incredibly important. With regard to SNAP and WIC, so SNAP will continue. WIC is running out of money. The president says that he's going to try to move monies to some tariff money, perhaps, to try to pay for WIC. But I'm not sure how he can do that legally. In any case, it's of great concern because so many people do utilize that particular program, and it's important for infants. Okay. Kathy, are undocumented people really receiving taxpayer-funded health care?
No, the short answer, there's no federal funding for healthcare or health insurance for undocumented folks, certainly not through the ACA exchanges and not through Medicaid either.
Well, let me ask you this. I'm a constituent from Elgin, Illinois. My question to Rep. Krishnamoorthi, but I'll also ask you, Kathy, since you're here. How will Trump's big, beautiful bill affect Medicare, on which both my husband and I rely. Will there be cuts in benefits? Maybe I'll start. So the Congressional Budget Office estimates that there's $500 billion of cuts to Medicare that will have to happen, mainly because of an accounting issue, an accounting law that requires that there be cuts when the budget deficit exceeds a certain size. Unfortunately, the large, lousy law, which he calls the big, beautiful bill, is exploding our deficit and debt. Okay. These tax cuts for the wealthiest are not paid for in any way. And so, as a consequence, they are going to affect our budget deficit and lead to cuts in Medicare. But Kathy, can you comment on this as well?
Yeah, I mean, on Medicare, you've characterized it exactly how I would. These cuts come down the line. They're because of the increase in the deficit, and it means that we could fix it, right? If this Congress or a future Congress was really committed to helping folks have good health and financial health, they can come back and fix this by undoing the cuts in the one big beautiful bill. And that would also ensure people have access to health care.
Right. And I think my concern is that this I'm going to call it the large lousy law is essentially doing two things at once. It's basically hurting people at the lower income levels who need to access the social safety net. As a product of the social safety net, this is personal to me. And so it's going to hurt them because it's going to hurt their access to that safety net. And it's going to worsen our fiscal position so that all of us are impacted. And it's going to lead to cuts in Medicare under the laws governing how we do budgeting in Washington, D.C.
Yeah. I also, if I could just, Congressman, we also can't overstate the harm on the healthcare sector and access to healthcare as a result. When we talk about money going into the healthcare sector, it can feel a little weird, but we're talking about hundreds of billions of dollars lost in the healthcare industry. That is your care. That is you going to the doctor and getting the care that you need. So we're going to see clinics closing. We're going to see hospital closures, we're going to see department cuts. So whether your Medicare is impacted or not, you may not be able to go to the provider you've been going to.
Well, that's exactly right. I was in downstate Illinois. 9 rural hospitals are set to close. Unfortunately, even hospitals in the city of Chicago will likely be put under extreme financial pressure with uh, the the president's large lousy law. Okay, Kathy, here's another question. This is slightly different than the ACA. This is about, will Illinois institute work requirements for Medicaid recipients? And I believe that there are already work requirements, but the large lousy law basically requires even additional work requirements. But go ahead.
So when we're talking about Medicaid or healthcare in general, we do not have any work requirements in the state of Illinois. There are some existing work requirements in SNAP that the law expanded at a shockingly rapid pace for the state. But on the Medicaid side, there is no ability for a state to opt out of implementing work requirements. So in a couple of years, between 27 and 2029, we're going to see the state of Illinois implement work requirements for the 770-ish thousand people who are enrolled in the Medicaid expansion. This will also come at the same time that we're implementing other red tape measurements, all of which are designed to kick people off of healthcare through bureaucracy. So we will see that happen. Exactly what that looks like, we don't know. We're waiting for guidance from the federal government. The state can't know what to do until the feds tell them what they will approve. And we haven't seen any of that guidance. And then the state will need to make decisions from there to try and determine basically, and I think we will see this in Illinois, within the confines of the law, the state will try to protect as many people as possible from those work requirements, make them as easy to comply with as possible, but they will absolutely happen, and they will be really challenging.
And I think with regard to these work requirements, I think they're slightly misleading in the sense that um, a lot of people are already working.
Yes,
It's just that proving that they are working by doing the paperwork amounts to not just, it's not necessarily a work requirement, but a paperwork requirement. And that
absolutely.
paperwork requirement and those obstacles are what, unfortunately, I hate to say it, they're cynically designed to basically get people off the rolls, even though they qualify otherwise to receive the care. And so that's why I find it to be morally objectionable to institute these types of requirements, in addition to being just bad public policy. Okay, Kathy, next question. Um, well, look, I'm getting questions from people who are on Medicare right now, and there are a lot of them. So this is actually coming from the helpline email. Um, and so, what can you say about people who are on Medicare and how they're being affected? We talked a little bit before about these cuts that are required under the budgeting rules, but are there any other practical ways that they would be affected, in addition to the hospital, the threat of hospital closures or anything else? And what can they do to kind of help themselves guard against the negative impacts?
Yeah. I'm not surprised we're getting so many questions, even though there are fewer direct impacts on Medicare, because I think the biggest threat to everybody right now is confusion,
Right.
right? The ability to use healthcare, to use your health insurance requires a certain level of confidence, of knowledge, of support. And the context that we're in, that we've been in for the last 8 months, completely undermines that. So there's absolutely a feeling that is not wrong, that we're in a crisis situation and everybody is affected. And that is true. We will all see increased costs, right? Folks who are enrolled in Medicare still have cost sharing and other expenses that can be quite significant. And that's not going to go away, and it could get worse. We are also going to see these changes in terms of access to healthcare when it comes to the folks who are the providers going out of business or reducing their availability. But those are kind of the most significant things. I think there's fewer direct impacts for folks with Medicare. And truthfully, my answer to everybody, even though I'm out here, right, talking about what's at risk and trying to help people understand, the flip side of that is you should be using the benefits that are available to you right now in the way that they're available to you. So, Medicaid changes don't start until next year. Most are a couple of years out. This marketplace stuff is much more immediate. Medicare changes those cuts may never happen, right? Congress could choose to circumvent those cuts.
So are you saying
Um,
front load some of your care now? Is that part of the,
I
what
think,
do you think about stuff like that?
if my parents are enrolled in the marketplace, right, they'll be eligible for Medicare in a little while. I'm not telling them to wait for their hip replacements, right? Like, I'm not telling folks to wait to access care if you need it today. I'm making sure folks know that they should enroll in something, even if the ability to keep that program might change in the future. Um, and I'm acknowledging that sometimes that's going to come with hard decisions about how to make this all work financially. But my message to folks enrolled in Medicare is you shouldn't see any significant changes in terms of your benefit structure anytime soon, but you might, over the next couple of years, notice that it's harder to get the care you need if we don't act to undo these changes.
Right. Okay, here's the next question. Okay. Why are de why are Democrats fighting so hard for ACA tax credits and Medicaid? I know that it's going to primarily impact rural red areas. Shouldn't Republicans be leading the charge? Maybe I'll comment on that. Look, I think that actually these tax credits and Medicaid impact broad swaths of society at this point. Interestingly, in Illinois, 1 out of every 4 people are enrolled in Medicaid. 40% of births are covered by Medicaid. 70% of nursing home stays covered by Medicaid. So this is something that affects both, I should say, rural, suburban, and urban areas, and that's why it's the right thing to do to advocate for it anyway. But it's also in our best interest to advocate for our constituents. But do you want to comment on this as well?
Yeah, when it comes to the healthcare tax credits, there is no person with health insurance who will be unaffected. Um, we are looking at 28% increase in premiums in the state of Illinois. In the 8th congressional district, we're looking at an increase of almost $800 a month in premiums for folks who enroll
Wow.
on the exchange if these tax credits expire. That's
Can you
30,000
walk through
folks.
that for a second? Like if the tax credits expire, you're saying it's $800 a month for those people who would otherwise benefit from the tax credits, essentially?
Yeah, so you have the increase in healthcare costs or health insurance costs for all of us. Get Covered Illinois says that's about $130 a month on average across the state. It looks very different county by county. So everybody has that initial increase, but folks who will no longer receive healthcare tax credits if these expire have a much larger jump because right now, no one who receives these tax credits is paying more than 8.5% of their income to their
Okay.
premiums. Right.
Okay.
And so we could see, like that example of a couple that's a 60-year-old couple making $82,000 a year, they would be just above the line and they would stop receiving any tax credits and they'd be paying $18,000 a year more for their health insurance. So yeah, it's going to affect everybody. But for folks who are just above that income eligibility and will lose all healthcare tax credits, their premiums are going to potentially double or more. Um, and again, it's when I look at the numbers, even we don't have a lot of good data yet because we're still waiting to see. But the best data I have is by congressional district. There's not a lot of variation. It's a significant impact no matter where you live in our state.
I mean,
And I think,
$800 is kind of
yeah,
crazy. And that's what people are like I know we've got a family of five, so I mean, it seems like my whole paycheck is health insurance at this point. But like, I feel like just a couple years ago, $800 was a big number to pay for your entire health insurance for 1 month, and now you're
yes,
talking about a healthcare spike increase of $800, which is just to me that's bonkers.
yes.
Okay, I'm going to ask you another question here. They're coming in fast and furious. Oh, this is it. Okay. As a person who has experienced housing insecurities and living with a disability, what impact will these changes, I presume the Medicaid changes, have on services that bill through Medicaid?
Yeah, it's a good question. So there's kind of, when I think about the Medicaid changes coming from the reconciliation package over the summer, I think of it in two stages. There's the stuff that's written in the law that we know is going to affect people's access to care, work requirements. Just because you have housing instability, just because you have disabilities, you may not have Social Security disability verification, right? So you might be in that Medicaid expansion population. A lot of folks with disabilities are in that population. And so you might be subject to these work requirements, to more frequent verification checks, increased cost sharing, sort of
Okay.
all these really concrete things. And then the other thing the bill did, which I'm even guilty of not talking about enough because it's still a little ambiguous, is it changed the way the state can finance Medicaid. And as we have changes to our provider taxes and our state directed payments, which are wonky ways of saying how the state of Illinois pays for the care everyone receives in Medicaid, we will see the state be forced to make a whole lot of cuts to eligibility, to services, to provider rates, and that's again in out years, 3 to 5 years from now, we'll start to see the impact of that, and that's when we're going to see people in every category of Medicaid coverage see that their access to care is reduced in some way.
So, first of all, I should also mention I was in Chicago today at Loretto Hospital, which is really a fine facility, a community hospital that does really the Lord's work in helping people. And something like uh, 75% of their patients are Medicaid financed, essentially, and another 15% roughly are self-pay or charity care, essentially. And so, any kind of changes to Medicaid are going to affect Loretto in a profound way. I also visited a nursing home in Rockford, and that place has 76% of its patients covered by Medicaid. And that's another big problem if Medicaid is cut in terms of affecting them. We have many, many audience questions we couldn't get to tonight, and we're going to schedule a part two of this discussion soon. I want to just mention my number again. It's 847-413-1959, 847-413-1959. And my email is il08.helpline.mail.house.gov. It's a long one. But you can call me, you can email me, and my excellent staff will be at the ready to help however we can on any of these questions. Um, Kathy, another question I got is, Congressman, do you think you're going to be able to find a deal with the Republicans? Um, I hope so. I think that this is one of those solvable problems. And the reason why at this point it's solvable is because we know what the solution is. Obamacare tax credits are crucial for people to be able to afford health care. When they were instituted, since the time they were instituted, 12 million more people were able to access health insurance. Think about the countless conditions that people were able to address in a timely way. Think about the children and the families that were helped in profound ways. And this is not only the right thing to do, it's also, in my opinion, the long-term cost-effective thing to do because they're going to go to the emergency room otherwise, and it's going to spike all of our costs. Kathy, I'd like to give you a minute to say to give your closing comments, and then I'll do the same.
Yeah, I think it's difficult to overstate how significant the threats are and have been to healthcare in the last year. In my 15 years doing healthcare advocacy, I've never seen anything like it, and it it leaves me feeling deeply concerned, and also I want folks to know that nothing is irreversible. Especially not right now. And so Protect Our Care Illinois is a coalition of more than 100 organizations across the state, including providers and researchers and advocates and community groups who are working to defend the Affordable Care Act and Medicaid from federal cuts, because we know that right now what Illinoisans and people across the country want to see is better access to health care, lower costs for their insurance and just about everything else. And the being able to extend or even make permanent the healthcare tax credits will go a long way in achieving that goal. We would also love to see the cuts in this summer's legislation reversed because, again, people should have more access to healthcare. So I thank you, Congressman, for having this conversation. And I want to leave folks with a sense that all is not lost. And most importantly, you should not opt out of health insurance right now if that's within reason. Hopefully we find a deal on the tax credits, and I would encourage everybody to enroll on November 1st.
So everybody, I literally have 1 minute. I just want to say thank you, thank you, thank you to Kathy. You've been an indispensable resource, and we look forward to talking to you again. And the reason, again, why we're bringing this up is we want everybody to know that when they receive these notices, don't panic, okay? But voice your support for a deal and tell others that you want this to be negotiated to a resolution ASAP. And I feel that we will get to a deal, and hopefully it will be soon. But in any case, um, approach this deliberately. Contact me, contact us with questions. This Obamacare, these tax credits won't expire until the end of the year, but open enrollment starts November 1st. So we just have to kind of watch the timeline very closely starting now through the end of the year and kind of get a deal done. So with that, I'll just say thank you and thank you for tuning in, and look forward to seeing you again. God bless. Thank you.
Thank you.